All right, so this week we're going to be discussing nerve entrapments and nerve impingements, more specifically that are not from disc herniations. So if we do our tests and we rule out a disc herniation, one of the next things we like to do is palpate. And the first nerve that we're going to talk about in the lower body is the sciatic nerve. So to find the sciatic nerve, we'll start by finding what's called the greater trochanter, and that's that big bony part of the hip at the top here. And we start to go directly down towards the tailbone or the sacrum. And a muscle that can commonly impinge the sciatic nerve here is what's called the piriformis muscle. And so if there's any reproductions of signs or symptoms from the patient, if it hurts or it shoots down the leg, we most likely have found our impingement point. And another area that's common with the sciatic nerve around the hip region is if we find that greater trochanter and go down a little bit lower, there's another big prominence called the ischial tuberosity. You can feel it right here. It's kind of in between these two markers, and this ischial tuberosity is where the hamstrings originate and go down the leg. And then we can just follow the course of the hamstrings in line with that sciatic nerve. Now, if there's ever a history of hamstring injuries or trauma to the area, this can very commonly impinge that sciatic nerve. And one other test that we'll do is we'll have the patient lie on their back here. So if we're suspecting that piriformis muscle that's pinching the sciatic nerve, if we slack it and lift the leg out laterally to the side, this most likely will not reproduce their signs and symptoms. But if we tension it and stretch it across the body this way, this can put stretch on that piriformis muscle and impinge that sciatic nerve that can either create the problem locally or down the leg. Coming down off the sciatic nerve, we have what's called the tibial nerve. Now, a common spot for the tibial nerve to be impinged is behind the knee. Sometimes Baker's cysts can do this, but if it's just tight in general, an easy way to find it is we have the big two hamstring tendons on the outsides of the knee. On the lateral side, there's the bicep femoris. On the inside is the semitendinosus. And we just go right directly between the two. So I'm going to apply pressure right in between those. And if we don't have any reproductions of signs and symptoms, I can go up a little bit above the knee. And then we can also start to go a little bit below the knee. But once we get to the top of the gastrocnemius or the top of the calf muscle, that's where it starts to get deep at that point and you won't be able to feel it as well. So again, the tibial, start right behind the knee. We're gonna go up a little bit and down to see if there's any impingements in this area. Okay, next we're gonna be discussing the common fibular nerve. So this one comes off the sciatic nerve and off the tibial nerve. It's very common with foot drop. The way that we can start to find it is we have that outside hamstring tendon called the bicep femoris. It's just to the inside or just medial there. So that's how I can palpate it underneath the knee joint. From here, it's gonna wrap underneath the head or the neck of the fibula. So if you feel that big bone on the outside of the leg right there, very commonly, it's very easy to palpate. So I'm over it right now. So again, if I put pressure here and we see signs and symptoms reproduce, that could be an impingement point. And then from here, it's going to cross over into what's called the fibular tunnel around this point right here. So you can continue to palpate it. And then once you lose it, at that point, it has gone into that fibular tunnel where it starts to get deep again. So this is the common fibular nerve. We start underneath the knee, underneath the neck of the fibula, into that fibular tunnel. Next, we're going to be discussing the sural nerve. So this will come off the tibial and the common fibular nerve. Typically where we can start palpating it is at the lateral bottom of the calf or the gastrocnemius muscle. And the way that we're trying to find it is we just are able to roll off the nerve. So I was able to find it right here where my middle finger is at, where we can roll off. And then we're going to just follow it all the way down. And it's going to go on the outside or the backside of the lateral malleolus, so behind that ankle bone, and it's going to innervate the lateral and the top of the foot here. So it is a sensory nerve, so typically you may feel lack of sensation in this general region right here. And if you ever wanted to tension the nerve to produce signs and symptoms, we would dorsiflex and invert the foot, just like so. All right, next we're gonna be talking about the tibial nerve at the ankle. So this is by far the most common nerve entrapment in the lower extremity. Very common with heel pain and any sort of pain on the inside or bottom of the foot. So it's very common to have it entrapped in the tarsal tunnel, but to find this nerve more classically, it's in between the Achilles tendon and the medial malleolus here. So again, we're trying to find that rollover of the nerve as we're palpating. And then once we find it, we can start tracking it down. Now, once we get below the ankle, it does branch into separate nerves. You're gonna get what's called the medial calcaneal, where that goes to the calcaneus area. So again, if you're feeling that heel pain or bottom of the calcaneus pain, most likely an entrapment there. And then it'll also branch into the medial lateral plantar nerves, which go more so to the inside and bottom of the foot by the plantar fasciitis area there. So that's the tibial nerve. Next, we're going to discuss the superficial fibular nerve. This does come from the common fibular nerve, and this is a sensory nerve over the top of the foot. It's most commonly irritated or damaged from ankle sprains. So when you want to imagine an ankle sprain, or if you ever wanted to put stretch on this nerve, you would go into plantar flexion and inversion. So if that irritates the patient, it could potentially be a superficial fibular nerve entrapment. An easy way to find this one is we go up a few inches from the lateral malleolus, and it's in between the peroneus tendons and the digitorum. So once we find that rollover, again, we just work it down. And then once we do get it down to the top of the foot, it will branch into the medial and lateral branches. But that is how we palpate the superficial fibular nerve. The last nerve we're going to discuss is the deep fibular nerve. The way we will find this one and palpate it is we go over the ankle joint or the talus. And from here, we ask the patient to lift his toes up. And you'll see this big tendon. This is called the extensor hallucis tendon. And we just go medial to it, so where we're between that and what's called the digitorum tendons. So he could relax here. And what we do is we're going just on the inside of the first metatarsal bone of the foot, finding that rollover and seeing if we're reproducing any signs and symptoms. And this one innervates mainly the first and second toes, and very commonly the web in between those toes. Usually it's trauma that injures this nerve. Another very common one is if there's straps of any high heel shoes. As you can see, it would be potentially impinging that nerve that runs right down those toes right there.